Hello everyone. In this video we are going to learn how to perform the knee joint lateral mobilization with movement technique to improve joint range and decrease pain in patients who come to physiotherapy OPD with complaint of knee joint stiffness. To perform the technique, the patient is going to be in the supine lying position and the therapist is going to stand at one end or one side of the couch closer to the knee joint. So let's say in this case we are treating the right side of the patient. So now to perform the technique, let's say this patient has restriction in the knee flexion range beyond 45 degrees. So the knee is going to be kept just before the resistance barrier. And now from here the therapist is going to utilize the manual contacts. So to deliver the lateral mobilization to the knee joint, the left hand of the therapist, which is the cephalad hand, is going to be placed over the lateral side of the femur closer to the knee joint and is going to apply a stabilizing force from the lateral side, whereas the heel of the right hand, which is the mobilizing hand, is going to cover the medial portion of the tibia closer to the knee joint in this manner. And now from here the therapist is going to lean down and bring both the forearms perpendicular to the long bones of the leg and the femur. And now the right hand is going to deliver the lateral mobilization glide. And after this glide has been delivered, we are going to ask the patient to start bending the knee joint into flexion ranges. And we are going to go across the barrier if the movement is not painful. And now from here we can also deliver over pressure using the sternum like this manner, and again we will take the knee joint back into the ranges of extension. Similarly, if the patient has the extension leg, let's say from this range onwards, we can do the same thing. Apply the lateral glide, keeping the forearms perpendicular to the bone, and now from here we can ask the patient to perform knee extension, and then we can deliver over pressure either manually, passively by the therapist, or the patient can do so by pushing the knee down into the treatment couch and relax. This can be repeated for 6 to 10 repetitions and 3 to 5 sets. For many patients, the contact points over the stabilizing and the mobilizing area are often painful. In that case, it is advised that we can use paddings and then we can use our mobilizing force and then can deliver the manual therapy technique. The same glide can also be performed with the use of the mobilizing belt with the patient in prone lying position. So this was all about the knee joint lateral mobilization with movement technique. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.